Hi, I'm Dr. Stevens. I'm one of the GPs here at Amicus Health. I'm making a short video today to talk about the NHS cervical cancer screening programme. The cervix is a part of the body that's located at the top of the vagina, and it's the entrance to the womb. Cervical screening aims to pick up abnormal changes in the cells of the cervix so that any changes can be treated early and prevent them going on to becoming a cancer. The NHS cervical cancer screening programme is offered to women and people with a cervix between the ages of 25 and 64. Between the ages of 25 and 49, it's offered every 3 years, and between the ages of 50 and 64, it's every 5 years. You'll receive a letter in the post inviting you to book an appointment for your cervical screening test, which is usually done at the GP surgery. Your cervical smear appointment will usually be with one of our practice nurses. At the appointment, they will ask you to undress from the waist down and lie on the couch with a sheet to cover you over. They will then ask you to raise your knees and put your feet together, and then drop your knees down to the side so that they can insert a speculum. A speculum is a plastic device that lets us see the cervix. The nurse will briefly have a look at the cervix and then use a soft plastic brush to take a sample of the cells of the cervix, and that's what forms the smear test. After this, they will leave you behind the curtain to get dressed. The whole appointment takes only about 10 minutes. Most cervical cancer is caused by a really common virus called HPV. Therefore, when your sample reaches the lab, that's what it's tested for first. The majority of smear samples are negative for this infection, and then those people will go back to the normal recall of 3 to 5 years. If HPV is detected in your smear sample, then the cells will be looked at more closely under the microscope. If the cells are found to be normal, then you'll just be invited for more frequent smear tests. If the cells are found to be abnormal, then you'll be invited for a further investigation called colposcopy. A colposcopy is a more detailed examination of the cervix, where biopsies can also be taken if needed. Sometimes the brush doesn't pick up enough cells for the sample to be tested. If this occurs, you'll get a letter in the post inviting you to book in for a further smear test. If you've missed your smear appointment or you've changed your mind about having a smear test, please contact the practice and we'll help you to book in an appointment. There are very few disadvantages to having a smear test. Some people can find it a little uncomfortable, but it's really important to know that you're in control at the appointment and you can ask the nurse to stop if you're in any discomfort. The smear test is not for people with symptoms. If you have any symptoms that you're worried about, such as bleeding after sex or bleeding between your periods, then it's really important that you seek advice from the doctor, even if you've recently had a normal smear result. Since 2008, there's been a vaccine available for HPV. However, even if you've had the vaccine, it's still really important to go ahead and have your smear test. The NHS cervical cancer screening programme aims to detect changes in the cells of the cervix early before they go on to become a cancer. This screening programme helps to save many lives in the UK each year.